Being diagnosed with breast cancer is a life-changing moment. Once that cancer diagnosis is given, you will always be a survivor.
Knowing there was something in my body was totally terrifying. When you think of cancer, you think of all the things that go with that. It turned out that I have the BRCA1 genes. I didn't really know how much time I had.
Someone's cancer journey is very terrifying. There's a lot of unknown, uncertainty, and it's a different language for patients. And what has been different in the past few years is that we are seeing younger and younger patients with breast cancer.
The rise of breast cancer could be that we have become so much better at early detection. The earlier stage we can catch the patient at, the better chances of providing them with cure. The biggest differentiator about Mayo Clinic and improving early detection is specifically our high-risk clinic.
Using biomarkers, contrast mammography, helping women really know when to be thinking about breast cancer to make sure that this is the best individualized treatment for the patient. This is the future, and it's really exciting.
There's a benefit in referring patients to Mayo because of the multidisciplinary care, the teamwork that we provide.
We want to be a one-stop shop for these women. Nothing about this is a vacuum or a silo. It really takes a large group of experts.
The input of the medical oncologist, the surgeon, the radiation oncologist, the radiologist, the patient is at the center of the care.
I don't know what my outlook would have been if I hadn't come to Mayo. When I came in for one of my pre-op appointments with Dr. Ree, he walked in, he shook my hand, and then he just held it, and he said, "I will get you there." The techniques that my doctors here used made my recovery a lot faster. Mid-April, I found out I was 100% cancer-free, and that is a true miracle.
We are seeing better outcomes because we're able to catch breast cancer at an earlier stage.
By working with partners, we are able to offer the most advanced treatments, pre-surgical treatment, surgical treatments, radiation therapy, proton beam therapy, things that were not offered previously, and therefore women are living longer.
It's a critical part to ensure that we have safe and effective treatment. They are seen as human beings, not just patients or statistics coming in the door. It's our job to ensure that we're providing the support that they need.
We are going to work with the patient and provide her options because that's what people before us did, and that's what we'll continue to do.
The cancer journey can be long, it can be draining, and that's one of the reasons why I wanted to be in women's health, so I could make sure I'm an advocate during a difficult time.
I came to Mayo Clinic not really knowing what my outcome was going to be. Now I have time to live the rest of my life. It's everything I have to look forward to.